Today we are talking about aging eyelids with eye consultants of Fargo.
Dr. Michelle Atchison and Dr. Ann Keating are here with us today. Thank you so much for coming in. And we want to start with, what are the most common symptoms of aging eyelids?
One of the most common symptoms of aging eyelids is a heaviness or a fatigue of the eyes, especially as the day goes on. Many patients complain that their eyes feel tired, it's difficult to read for very long because the eyes are heavy and it's hard to keep them open. Another very common symptom is that some patients, especially when driving, notice that if they actually lift their lid up, they can see better. And if the camera is able to show a picture of an example of a patient, this is not one of our patients, but one that we were able to borrow from our Academy's website. This is a very common type of aging lid where there's extra skin that's started to come down with gravity and with time that's starting to weigh the lids down and impact the vision.
Okay, so one of these patients comes in, they want to be treated. Now, how exactly are these aging eyelids treated?
Sure. Well, the first step is to have a consultation with an ophthalmologist, and during that consultation, we'll determine what's actually causing the droopy eyelid. For instance, the most common cause is what Dr. Keating already mentioned, which is just excess upper eyelid skin. Happens with age due to elasticity of the skin. But there can also be other causes, like problems with the underlying muscle that lifts and lowers the lid. And so we'll do some testing to try to figure out what is the underlying problem, and also do what's called a visual field test, where we map out the peripheral vision and see how much of the upper visual field is restricted or blocked from the upper eyelids. And then the next step, if we determine that it is indeed what's called dermatochalasis, or extra upper eyelid skin, just an aging process, we'll talk about doing a blepharoplasty surgery. And what that involves is a same-day outpatient surgery. It takes about 30 minutes, and it's done under a little bit of local anesthesia with some sedation. And we just make a small incision in the upper eyelid crease, remove some of that excess skin that's weighing the upper eyelid down, or sometimes it's overhanging the eyelashes and blocking the vision. So overall, a pretty simple outpatient procedure, and it heals quite quickly. We use dissolvable sutures, so there's not a lot of aftercare. It does cause some bruising for about a week afterwards, but that's something that we can discuss further at the consultation.
Does insurance cover surgery for aging eyelids?
In general, insurance does cover most surgeries for the aging eyelids. It does need to be considered medically necessary and impacting the vision enough for them to approve it, but we usually can determine this at the time of your consultation. And sometimes you do have to submit the results and the testing to insurance to get authorization prior to surgery.
And you touched on this already, kind of, but when you think of aging eyelids, it's not just a vanity thing. That's why insurance will cover it. Can you kind of expand on that when people want to understand why it's a medically necessary surgery?
Absolutely. I hear all the time from patients that have had the surgery, they didn't realize how much their vision was really affected, that they can see better when they drive, that the world's more open afterwards. And so it's just such a gradual process that oftentimes patients don't really notice how much it impacts until it gets to a point where they're really just lifting the lids manually to see things.
I know, when you did that example, I was like, you're right. And you know, when we talk about aging eyelids, aging could be at different ages, correct?
Right. There's a wide variety of when patients might need this type of surgery or come to see us, and some of that's genetic too. Some families just develop droopy eyelids earlier than others.
So how can people get a hold of you? Because you mentioned it's a great idea just to give you guys a call so you can come in for the consultation. Where are you located? What's your number? What's the best way to get started if you think that you have aging eyelids?
Absolutely. Our number is 235-0561, and our website is eyeconsultantsfargo.com.
Okay.
So give us a call.
Well, thank you so much.
Right.
Interesting to talk about, for sure.
Thank you.
Coming up next on North Dakota Today, we have our fashion expert, Aji Berg, with us to talk about some great summer styles that are just as hot as the temperatures right now.